This would be a pregnancy that has poor maternal or fetal outcome, maybe due to medical. So when you say medical, the mother might have any medical problem, like for example, your diabetes mellitus, uh, GDM, as we call it, no, gestational diabetes mellitus. It only comes out if the mother is pregnant. Okay? So due to maternal hormones, the mother's blood sugar is undetected by her insulin. Okay? So the sugar level of the mother there is very high. And other medical problem would be your PIH, no? Somehow, this would have a poor maternal or fetal outcome if left untreated. Mostly, if the mother is pregnant, no, and she has high blood pressure, and if the obstetrician would give her, no, uh, medicine to control hypertension, then uh, magkakaroon ng fair or good outcome yung pregnancy ni mama. But if it is left untreated, this would result to poor maternal or fetal outcome. This might cause the death of the mother or death of the baby. Kasi kung vasoconstricted lalo po yung inyong mga blood vessels, no, it would contribute to the stimulation of the uterus to contract, as well as the fetus would have deficiency when it comes to nutrients and blood supply. So, pwede siyang pwede siyang magiging malnourished or small for the gestational age, no, yung baby natin. As for the reproductive, might be that there is a problem, no? Like for example, congenital anomaly sa uterus ni mama na kumbaga, like for example, a septum divides the uterus into two. So there is no room for the baby to grow, no? We have not all, no, mothers would be given a uterus na tawag dyan, maka-result ng pregnancy na mag-reach ng full term. No? Some of the mothers would have preterm pregnancy due to the space that the uterus has. No? Kung ma-divide ang uterus into two, so magiging maliit lang yung space for the baby to grow. Might be if it is already stretched, no? And hindi pa talaga full term si mama, the mother might give birth na due to congenital anomaly, the structures of the reproductive system, no? And psychosocial, of course, particularly the environment and the people that surrounds the pregnant mom. Okay? Is the environment conducive for a pregnant mom to have her baby? No? Ang mga tao sa paligid ba niya, are they, did that particular persons look at the pregnancy of the mom positively or negatively? When it comes to obstetrical, one way or the other, is it the first time of the mother to get pregnant or the mother has a history already of some difficulty, no, ng previous pregnancy niya? Okay? Somehow, like for example, if the first pregnancy, I'm referring to obstetrical history, if the pregnancy is history has a preterm delivery, like yung first delivery niya is preterm. So might be na pwede din magiging preterm yung present pregnancy niya. Okay? But in order to prevent this one, we must know the factors why the mother would have preterm labor. Okay? So yan. So pinaka-importante talaga is to submit or encourage the mother, no, to have prenatal check-up. That is why sa umpisa pa lang, nire-remind talaga namin kayo, no? Even in high-risk patients, the more ka magpunta dapat sa obstetrician to have yourself checked, no? Kasi hindi po madaling magbuntis. Kasi immunocompromised yung buntis, right? Kasi nga, nagiging parasite yung baby sa loob ng tiyan. Asan ba siya kumukuha ng nutrients o sustenance kundi sa mother? If the mother is not doing well, not eating well, no, has medical, reproductive, psychosocial, obstetrical history problem, so the baby inside the womb might be affected. All right? So in order for us, no, to know if mother has any problems during pregnancy, the mother must undergo screening. So meron tayong diagnostic and laboratory examinations. I know in NCM 207, this particular diagnostic and laboratory examinations are already discussed. So I do hope so, no? The first screening would be your count. Alright, incomplete blood count kasi, this is a standard operating procedure ng hospital talaga. Because we wanted to know the hemoglobin count of the client. Yung hematocrit niya, the capability of the blood, no, to coagulate. Then, leukocyte count. Of course, we also have what you call the thrombocytes, no? Ang functions ng platelet natin. Baka naman masyadong mababa yung kanyang prothrombin time, no? Magkakaroon ng bleeding tendency si mother. Alright? And of course, the blood typing, and of course, important also is the rhesus factor. Why is it important that we have to check on the hemoglobin of the pregnant mom? Itong CBC, hemoglobin and hematocrit, guys, is essential to determine the presence of anemia. Now, particularly anemia, because as pregnant women is prone to develop anemia in pregnancy. Kasi 'di ba, during pregnancy nagdo-double time yung heart produce, no? Yung vascular system ng mother around 30 to 40%. It is because para po masustain po yung needs ng baby inside the womb. Okay? Ang leukocyte naman natin, or what we call our white blood cells, is to determine the presence of infection. Pag tumaas yung leukocyte count ni mother, ibig sabihin, meron siyang infection. So, the doctor would readily give antibiotics to treat that infection. Kasi if it is left untreated, it can be, the baby inside the womb can be affected with the bacteria that is present in the blood. Alright? Kasi isa lang nga po yung circulation or circulatory system ng mother and the baby. The mother is the one that supplies blood to the baby. Whatever causative agent is found sa blood, pwede din yan ma-pass on sa baby, guys. Okay, and of course, equally important is the thrombocytes, or what we call the platelets, no? This is to determine, guys, the clotting ability during delivery. No, it is essential as the mother are prone to blood loss during delivery. Remember, normally mawawalan talaga or maglulus talaga ang mother via NSVD around 500 cc. That is 1 unit of blood. Okay? Tapos pag hindi pa talaga natin yan nalaman na yung pala ang mother is very hard na mag-coagulate, so the more blood will be lost, no? Kasi mag-bleed si mother. Okay? Ang blood typing, of course, in cases of emergency, guys, no? Kailangan talaga natin malaman yung blood type ni mama. And of course, SOP din po na if ever ma-determine na natin yung blood type ni mama, magpapastock po tayo sa laboratory. Just in case the mother would experience bleeding, there is already unit of blood in the laboratory for us to use. Okay? Yung blood typing and RH factor natin, documented because blood may have to be made available if the woman has bleeding early in the pregnancy. Itong rhesus factor, guys, okay, this is very important also because we don't want the baby to experience hemolytic type of disease, no? Because of the antibodies that kills the RBC of the baby. So, kung rhesus factor, dinidetermine dito kung RH negative ang mama or RH positive. Kasi we have corresponding, no? Medications for the mother not to develop antibody towards the positive blood. If the mother is RH, if the mother is RH negative and the father is RH positive, definitely, no, yung baby inside the womb of the mother is RH positive. All right? So, alien yun, no? Na ma-detect ni mama. So, if we do not give raw gum, ang tinatawag sa gamot na yun, if you do not give that to the mother, the baby might have hemolytic disease. Okay? Kasi pag hindi nabigyan ng raw gum, guys, ang mother mag-develop siya ng antibodies towards the Rh positive. Papatayin niya si baby, guys. No? In order for the mother not to develop antibodies, so we give raw gum. This is also to preserve future pregnancies. Every time the mother gets pregnant, we give raw gum. So the first injection of raw gum is given at 28 weeks gestation. The second would be after 72 hours, no? After delivery. 72 hours after delivery. After delivery, excuse me. All right. So, the next one here. Ito guys, guys. So, we go now to urinalysis. Okay. This is also SOP dito na laboratory sa patient natin. So, we have the cells, bacteria, protein, albumin, sugar, and squamous epithelial cells. So, cells, bacteria, this would indicate, guys, this would really indicate that the patient has infection or what we call urinary tract infection. That needs to be attended right away. Kasi pwede po siya magkaroon ng ascending infection towards the kidney and complicate the pregnancy. How about protein and albumin? We have to check if the ihi of the mother has protein or albumin because this will be an indication that our patient, pregnant mom, is experiencing PIH or what we call pregnancy-induced hypertension. Equally important is the determination of presence of sugar in our urine, no? So, pwede din natin sabi na the mother is experiencing gestational diabetes mellitus. Kasi, normally, hindi po dapat ito present sa urine ng mother. Okay. Ang squamous epithelial cells, this would really indicate, no? Kung madami na talaga siya masyado, guys. No? It's either kung konti lang siya, no, plus 1 lang, no, it might be the improper collection of our urine. But if the squamous epithelial cells is plus 3, plus 4, so there is something wrong with the kidney already. Supposedly, limited lang po yung amount ng squamous epithelial cells na lumalabas po sa ihi. Okay? So, and here we are, your pap smear. Mali. Pap smear pa tayo. Okay, pap smear. So, ay blurred masyado yung picture, no? So, we have here the vaginal speculum and a very long, no? A very long, para siyang cotton buds na very long, wherein it would be inserted and get a secretion, no? Sa cervix ng mother. So, pap smear is used to determine precancerous or cancerous cells on the cervix. So, if the mother is sexually active, no? Hindi lang man tayo buntis ang pinag-uusapan natin dito, no? Kasi OB, gyne na, no? Gynecology din ng mga diseases din. Sinasali, no? So, sine-check din natin yung presence ng human papilloma virus, okay? You have already heard na meron yung mga nagpapa-inject na ngayon ng immunization to protect themselves from this particular virus that causes cervical cancer. Alright? So, yan yun guys. Ito yung pap smear or your Papa Nicolau smear. So, this is one of the diagnostic procedure wherein we can really assure or confirm the presence of cancerous or precancerous cells sa ating internal structures. Alright? Particularly the cervix. Okay, another diagnostic test would be your ultrasonography. So, dalawang klaseng ultrasonography po ang meron sa buntis na piniperform. You have your transabdominal. As you can see sa picture, okay, yan siya yung transabdominal sonogram. So, ultrasonography is also called sonogram, guys. It uses lang sound waves to picture out the baby in the uterus. Okay, it helps also to check the fetal health and development of the baby. So kaya nga minsan, pag napapa-prenatal check-up yung mother, hinihingan niya ng doktor ng ultrasound. Through ultrasound kasi nade-determine natin ang age of gestation ni baby talaga. Malay mo, nagkamali or nakalimutan ni mama kailan ang last menstrual period niya. Yung LMP. So, yan, magkabuang-buang tahalamam. Based sa imong LMP, mga nakay na ka. But based sa ultrasound, kulang pa ang edad sa bata. O, di ba? So, ito siya guys, transabdominal. And the other one would be your transvaginal or what we call, hey ma'am, for TBS yung patient natin. Teka, mayroong nag-chat. Ay, okay. Noted. Okay, transvaginal ultrasound. So, a probe is inserted sa vagina to view the internal structures, guys, ng ating reproductive system. Okay? So, this is usually done in the first trimester of pregnancy. Alright? So, this is an effective way also to check the cervix, uterus, fallopian tubes, and ovaries for any anomalies. Particularly during the first trimester of pregnancy, it is also used as a confirmatory diagnostic test if the mother is really pregnant or not. Alright? Okay, okay, noted din mga moms ug sir. Okay? So, that is the two ultrasonography or sonogram that is done to OB-GYN mothers. Alright? Alright. So, sa picture pa lang, makikita nyo na talaga, no? Kung ano yan siya. So, we have the blood glucose test. So, we have the FBS or what we call the fasting blood sugar. The mother is made to fast around 8 to 10 hours, no? For a very good result, no? Blood sample will be taken after an overnight fasting. So, normally, no? Below 100 milligrams per deciliter, after not eating for at least 8 hours or 8 to 10 hours, then less than 140 milligrams per deciliter 2 hours after eating. So that would be considered as normal sa FBS natin. As we all know, no, sa CBG lang po yung 80 to 120 milligrams per deciliter na normal glucose level ng adult. Alright? Okay. So, kung makikita nyo sa mga MS books na tinatawag natin, itong HGT or CBG, the range would be 60 milligrams per deciliter to 120 milligrams per deciliter. Kasali na po yung bata dito, children. Pero kung adult, guys, it should be 80 to 120 milligrams per deciliter. Alright? So, we also have this OGTT or your oral glucose tolerance test. So this it would be fasting overnight and a blood sample will be taken in the morning. Then after taken with blood sample, drink glucose around 75 grams. Then take again a blood sample from the client. So for 3 hours po. This is a 3-hour monitoring of the blood glucose ng patient natin. So if the mother is made to fast around 8 to 10, 8 to 10 hours, tapos kukunan siya ngayon ng dugo at 6 in the morning. So at 6 in the morning, kukunan siya ng dugo. After an hour, kukunan na naman siya ng dugo, that is 7 o'clock. Pagka 8 o'clock, that is the second hour. So 9 o'clock will be the third hour. So most probably, the mother can eat at around 10 in the morning. So, can you see how hungry the mother would be kung ito ang ipapatest sa kanya ni Doc? Okay? So, ina-encourage talaga natin yung mother to eat limits lang. No? Kaya mahirap po lumaki ka ng lumaki, then the doctor would really have the idea, ipa-OGTT ko ito. Sobrang laki naman itong pagbubuntis na ito. You know, for the fact that we have the normal weight gain during pregnancy, right? Kaya, hindi tayo dapat sumobra doon or else masasubject tayo for this particular test. Okay? We also have our OGCT. Okay, this can be done any time of the day. But never gid tayo maggawa nito with an empty stomach. Alright? So, 50 grams of glucose. Then, of course, with a reading after an hour. So, a blood will be withdrawn pa rin after an hour. Alright? Then, we also have the 2 hours postprandial. So, ibig sabihin ng 2 hours postprandial, 2 hours after eating. Yan yung ibig sabihin niya. So, after 2 hours, so the blood will be taken. So, ito po yan siya yung HGT or CBG natin. Okay? Kasi if you take hold of a ticket that your patient is for CBG every 6 hours, CBG is usually taken before every meal, an hour before, no? So, we need 2 hours, no? For us to know really the true blood glucose level of the client. So, as you receive the blue ticket, guys, no? Na meron kang ganito na procedure. When you do your rounds, if you are assigned to this particular client, you would instruct the client not to eat from 9 in the morning until you get your until you perform your CBG. Or else, kung naganguya-nguya ang imuhang patient, no, when you get the CBG, you will have a positive false positive result. Ha? Kasi tumaas yung sugar level niya kasi nguya-nguya siya. Di mataas talaga ang sugar level niya. So, ang gawin nyo is instruct the patient from 9 in the morning until such time na makuha ka ng CBG. Then after kuha ng CBG, guys, kung merong sliding scale na tinatawag niyan, meron yan sa likod ng blue ticket, makikita mo above or equal to 140 milligrams per deciliter, 4 units of insulin. Regular insulin is to be given. So, pwede tayong magbigay niyan. No? RI 4 units. Kasi ang result ni mother is 150. So, magbibigay tayo ng 4 units. But after giving the insulin, you instruct the client really to eat because regular insulin is short-acting insulin yan siya. Ibig sabihin, rapid po ang kanyang action. So, madali pong ma-hypogly yung patient natin. Okay? Yan. So, now, ito, na-experience nyo naman ito, di ba? Na-experience nyo naman ito. Naturo na po ito as one of the diagnostic tests performed if the doctor suspect for any anomaly sa bata. So, this is a medical procedure used primarily in prenatal diagnosis, particularly of chromosomal abnormalities and fetal infections and sex determination. Usually, this procedure is done 14 to 16 weeks of pregnancy. Around 2 to 5 ml po ang i-withdraw sa amniotic fluid. Okay? Trans-abdomen po ginagawa, ultrasound guided procedure po ito. Itong nakikita nyo dito, ito, ultrasound po yan. Trans-abdominal ultrasound, then a needle is inserted to withdraw 2 to 5 ml of fluid. Alright? So, yan po si amniocentesis. Okay, this is another picture of one. No? And then, we go now to the chorionic villi sampling. So, as you can see, it is also ultrasound-guided procedure. No? And of course, a needle is inserted and we draw some blood in the chorionic villi. Okay? Sa kanyang placenta. Alright? So, a thin plastic tube is inserted also with the help of ultrasound through the vagina and cervix to reach the placenta. Okay? So, pwede din siya i-insert dito through the vagina and then through the placenta but with the guidance of an ultrasound. It will also detect birth defects, genetic diseases. And this is usually done 8 to 10 weeks of pregnancy. So as you can see, amniocentesis, chorionic villi sampling, these are invasive procedures that can trigger, okay, that can trigger uterine contractions, thus triggering preterm labor. And sometimes, no, walay swerte, particularly this chorionic line na pinapadaan dito sa niya. Look at this. So your cervix is being disrupted by this thin tube. So, ibig sabihin dumaan siya. So, this would be stimulated to open. That is why common side effect of this one would be spontaneous abortion talaga. Alright? Sige. So, we also have here your maternal alpha-fetoprotein. So, this is used also to detect fetal neural tube defect, such as your anencephaly, gastroschisis, and of course, your spina bifida. So, yung maternal alpha-fetoprotein, guys, is done between 15 to 20 weeks of pregnancy. The protein here is normally produced by the fetus liver. As the baby grows, more alpha-fetoprotein is produced. So, anencephaly is the absence of some structures in the head. So, wala siyang cerebral hemisphere. Okay? So, usually this occurs when the upper end of the neural tube fails to close in early uterine life. Alright? Yan. Ang gastroschisis naman, guys, is the abdominal wall disorder. No? Wala siyang peritoneal membrane. Alright? Kaya lumabas po yung kanyang mga internal structures. Okay, then it will be repaired as scheduled by the pediatrician. Alright? So, yung spina bifida naman, this is a disorder of the spine. Okay? Where it fails to fuse, no? Marami siyang types talaga ng spina bifida. Okay? Pero sa spine po siya, guys. Okay. Merong ano. Chat. Okay, this is a picture of a baby with anencephaly. No? Wala siyang skull. So the baby here sometimes will be born, no, alive, but it cannot survive, guys. Okay, so several hours after delivery, the baby dies. Sometimes umaabot din siya ng weeks or days, no? But seeing the baby, na ganito yung baby mo, para bang masakit sa dibdib, right? Okay. So this is also an example of your gastroschisis. Lumabas po lahat ng gastrointestinal structures ni baby. So early surgery po ang nire-require dito. So much so, ma-feed na po natin yung baby. But unfortunately, meron po tayong some feeding problems, no? Yan, mga feeding problems because of this one. So usually, no, itong mga complications na ito, no, the mother has other vices, particularly smoking, alcohol drinking, and of course, siguro young age or teenage mom. No? Hindi pa talaga ready po yung reproductive system natin na mag-bear ng child. Okay, so this is also your spina bifida. Congenital defect po, ito siya ng spine. Okay? This is your spinal cord, no? So, together siya, sama siya sa outpouching. Alright? There is a gap, no, guys, in the backbone. So, that is why there is an outpouching. Usually, if this is repaired, guys, the usual problem of the baby would be paralysis of the lower limbs. And sometimes, mental handicap po ang nangyayari sa baby. Okay? Yan. Next to that one is your Doppler velocimetry. So this would show the direction and characteristic of blood flow. So this is used to determine maternal, utero-placental, and fetal circulation. So, yun siya. Bakit kaya nagkakaroon ng respiratory distress yung baby? So, magpapa-Doppler velocimetry siya. Ayun pala, meron palang vasoconstriction or the baby has a twisted cord, mga ganun. mga insufficiency niya, makikita through Doppler velocimetry. Okay? Yan. So we also have your percutaneous umbilical blood sampling or what we call PUBS. It is also called as chordosynthesis or funisynthesis. It is the removal of blood from the umbilical cord for about 17 weeks using amniocentesis technique. This is actually to detect chromosomal defect also or other abnormalities. Okay? Next would be, of course, your biophysical scoring lies. Okay, so 30-minute observation by ultrasound po ito. So we have 5 markers. You have the non-stress test. You have the fetal breathing. You have the amniotic fluid. And then the fetal body movement. And of course, the fetal tone. So each of the measurement has a score of 2 points. No, if normal, and 0 point if not normal. All right? So let's start with your, okay, ito muna ang BS result interpretation. Overall, the 5 markers has a result of 8 to 10. So you have a normal fetus. Okay, 6, chronic asphyxia na po yan. No? So, when you say asphyxia, this is a condition arising, no? That the body is deprived of oxygen, causing unconsciousness, even death, or suffocation sa baby. So, the procedure is repeated, no? After 24 hours. Okay? Pag 6 yung result, yung biophysical scoring. Pag 4 naman, abnormal po ang result niya. And then 2, you have an ill fetus, so you need to terminate the pregnancy. The mother should deliver the baby. Marami kasing misconception or perception when you talk of the word terminate. Abikwat yun si baby. No. Ang ibig sabihin niyan, when you say terminate pregnancy, kailangan na pong ianak si baby. Kasi kung hindi, posible mamatay si baby. When outside, it can be resuscitated. Kuha? All right. Yan. So, let's now proceed to Nan's test. So, a score of 2 would be given if 2 or more FHT acceleration per movement. So, 1 naman if less than 2 accelerations per movement and 0, no acceleration. This is used to check, guys, the baby's health. Cardiac rate is monitored to see how it responds to the baby's movements. Kung walang galaw si baby, guys, walang acceleration po ang mangyayari. So, if the mother is subject for NST, make sure the mother is not hungry. Okay? Sometimes doon sa DR, merong mga galing sa mga clinics na umaakyat sa DR, right? Then they are for NST. So the mother, you would ask the mother, ma'am, kanusta ang last ni mo kaon? So ano po siya, hala, ganina po biya tuod to, unya alas 5 na. Unya imong isuggest, ma'am, pwede mo merienda sa ka. Kaon sa ma'am, kanang busog ka ma'am. Nya, pagsulod sa mama sa DR, okay, show the mother, no? The CR. Paihiasa. Kasi yung ating NST kasi guys would last around 30 to an hour depending on the result. No? Sa screen. Titingnan kasi yan ng doctor ang screen. No? Kung okay po, yan. I hope you can still remember the 3 parts of your EFF. Alright? Kasi importante po yon in performing the NST. No? Kasi we have what we call there the event marker that would mark, no? That would be given to the mother to press for movement. Kay dili man ta kabalo kung naglihok ang baby sa sulod until na-i-press ni mama, nilihok si baby, press. Pag gumalaw po si baby kasi, there would be an acceleration sa kanyang FHT and that would be a good result. Okay? Papaulit yan ni Doc, pangit result. Okay. Now let's go to fetal breathing. Okay. Score of 2 if there is 1 episode of breathing per 30 minutes and lasting for 30 seconds. Merong time na huminga si baby but knowingly the lungs is not functioning but it is growing. Alright? Yun yung ibig sabihin niya. Okay? 0, no episode period of breathing for more than 30 minutes and not lasting 30 seconds. Okay. Okay, so this would be an essential stimulus mode for lung growth, ang fetal breathing. Okay, so this is readily detectable as early as 10 weeks age of gestation. So, kailangan po talagang at least man lang merong paghinga si baby. And that would really indicate that the lungs is growing. Okay? Yan. So, let's go now to your amniotic fluid index. Okay? A score of 2, pag fluid-filled packet of 1 centimeters or more ang result ng ating BPS. Okay? 0 naman, no amniotic fluid or less than po ang kanyang measurement ng 1 centimeter in every packet. So, this would, your amniotic fluid index, no? Through ultrasound, it would assess the amount of amniotic fluid. In here, we would know if the patient has enough amniotic fluid sa loob ng kanyang tiyan or limited or very small lang ang amount ng fluid niya. Okay? So, yan. Dinidivide po kasi yung abdomen ni mama into 4. No, ang inyong imaginary line would be your linea negra. No? For the right and left and the umbilicus for the upper and lower half. So in this way, makikita mo yan ngayon sa BPS na picture na meron siyang hinati na 4 quadrants. So ang basehan nila sa lower abdomen would be the linea negra, and of course the upper would be your umbilicus ng mother. Okay? So next would be the fetal body movement. So a score of 2 would be given to the mother if 3 or more discrete movement of limbs and body in 30 minutes. So upon checking, no, makikita naman doon kung gumagalaw si baby. No? And then a score of 1 is less than 3 movements. Then 0, no movement. So bad tayo, no? There is something wrong with the baby or asphyxiated ba si baby? Walang enough energy to move, no? Kulang siya ng oxygen. Ganyan, pwede yan. So let's go now to fetal tone. So a score of 2 if there would be 1 or more episodes of active extension with return to flexion of limbs and trunk. Okay? Then a score of 1 if there will be slow extension with return to flexion. And of course, 0, no movement. Okay? So, yan. So, let's go now to hepatitis B determination. This is an SOP also in San Pedro Hospital that a patient would undergo HBsAg determination. Right? So, we have your hepatitis B antigen, HBsAg. So, the patient is reactive. No? Patient reactive, so the patient is positive for the exposure to hepatitis. Okay? Okay. So, if this would be the result ng HBsAg ng patient natin. So, we would be, if we're going to cater the patient, so we need to have this universal precaution in dealing with our client because we know for the fact that we can get infected with hepatitis B if we are exposed to blood or secretions of the client. Alright? So, yan. Kung non-reactive naman, so safe po tayo. But still, in order for us to protect ourselves, igamit pa rin tayo po ng working gloves in attending to the needs of these clients. So we have here hepatitis B antibodies, HBsAg, qualitative and quantitative. So, dito nakikita ngayon, kung positive ang result mo or reactive means you are immune and protected against Hep B and cannot be infected. So, you have already antibodies, no? pag ganito. But the doctor would really determine, lalo, di ba, pinapa-hepatitis B antibody kayo, ni-check kung enough na ba yung antibody towards hepatitis B, meron kayo. So you don't need any shots anymore. Kasi yung mga kailangan lang ng hepatitis B shots are those na below ang level ng kanilang antibodies. No? Because you can get infected with hepatitis B if you are exposed to that infectious illness. Alright? Yan. So, sorry. So we go now to contraction stress test. Alright? Or what we call the CST. So this is usually done after 30 weeks age of gestation. Negative siya, normal, no fetal heart deceleration. Ibig sabihin, pag nag-contract si uterus, normal lang po yung kanyang heartbeat within normal range, wala po nagbaba. Pag positive naman ang result, ibig sabihin abnormal. Tuwing nagko-contract yung uterus ni mama, bumababa po ang heart rate ni baby. So that would mean immediate attention. Alright? There are two ways wherein we can stimulate, there are two ways, no, to perform contraction stress test. The first one would be through oxytocin drip. Okay? Oxytocin is incorporated sa IVF po ng client natin. So, based tayo sa drip rate na gusto ni doc for us to simulate contraction. Okay? So, oxytocin po yan ang ginagamit na medication to stimulate the uterus to contract. The other way would be your nipple stimulation. This would also cause uterine contraction. Alright? So, stimulation of the nipple, oxytocin will be produced by the body. So, ang mangyayari, magko-contract po si uterus. Okay? Di ba si oxytocin ang nag-stimulate para mag-contract yung ating anong tawag mo dyan sa breast, guys? Yung kung saan nag-store ang milk. So, i-contract yun ni oxytocin for the milk to be ejected. And that would be your letdown reflex. Diba? Through suckling of the baby. So, kaya nga, meron tayong oxytocin sa katawan. Okay? And, kaya nga, meron tayong two ways. It is through medication and, of course, natural means, which is your nipple stimulation. Okay? Clear na tayo dyan? So, we will proceed to fetoscopy. Okay, when you say fetoscopy, copy, no? It is the direct visualization of the fetus through a scope. Okay, maggamit tayo ng instrument. Obtain sample tissues or blood. And of course, it can also perform intrauterine fetal surgery. So this fetoscopy, no? Ang instrument dito is the optical instrument inserted through the abdominal and uterine walls to identify fetal development. It is also used, nakalagay dito, to retrieve sample tissue and blood samples, no? This is to detect also hemophilia particularly or other disorders, no? And may be used for some types of fetal surgery. Kasi itong scope na ito, meron yan siyang butas, camera, at the same time, butas for an instrument to pass through, no? To obtain samples, tissue samples. That is why ito siya ang fetoscopy. Okay? So, we go now to fetal movement counting. Usually, ito ginagawa at after 27 weeks age of gestation. Done usually twice daily for 20 to 30 minutes. Normal siya kung 5 to 6 movements in 20 to 30 minutes. Abnormal if less than 3 movements in 1 hour. So you really have the patience here to count. And you have to instruct the mother also because she is the one that feels the movement of the baby. No? Ang atin is to instruct the mother how to count, no? Every time the baby moves. Alright? So we will now tackle medical complications during pregnancy. So, first would be the cardiovascular disorders. So, in pregnancy, guys, there is an increased blood volume of 40 to 50%. I have mentioned that one earlier. So, ibig sabihin, mag-double time si heart. There would be an increased cardiac output just to sustain the needs of the baby. Then, decrease ang blood pressure natin during the first trimester of pregnancy. Increase the size of ventricular chamber. Okay? Just to accommodate the increase in the blood volume. Para pag-pump ni heart, malaki po ang mabibigay niya sa lahat ng parts ng body. Alright. So, left to right shunting. Okay. Ang nangyayari dito sa this is one of the cardiac complication now which includes deterioration of the functional class such as your arrhythmias, pulmonary hypertension. So, ang causes ng left to right shunting can be ventricular septal defect, no? It can also be patent ductus arteriosus. It can also be your atrial septal defect or your atrioventricular septal defect. Okay. So, itong left to right shunting, ang Dr. Ani, dili pa mabalaka. Kay, left to right man siya. It won't affect whether your blood gets oxygen or not. Kasi nga, doon man nasa left po ang oxygenated blood. Okay? Okay. So, if you have this particular condition, it can go away without treatment, no? Pero pag ang nangyari sa patient is right to left shunt, ang ginagawa ni doc, surgery talaga po tayo. Kasi more ang unoxygenated blood na mag-circulate kesa sa oxygenated blood. Alright? Yan. So, ano ngayon yung atrial septal defect? So, asymptomatic po siya. But there is an increased pulmonary blood flow and the patient experiences pulmonary hypertension. So, this is considered as a congenital defect in which there is a hole in the wall of the septum, okay, that divides the upper chamber which is your atria of the heart. So, yan yung nangyayari sa atrial septal defect. Alright, so we go now to the ventricular septal defect. So, oftentimes it is called left ventricular hypertrophy, okay? So, pulmonary hypertension also happens at this particular defect. And of course, there is biventricular hypertrophy. So, lumalaki po ang ating ventricles because of the defect. Okay? Okay, itong birth defect na to, no? Birth defect ito ng heart na in which there is a hole in the wall, no? Sa septum niya that divides the left from the right, no? And that it separates the two chambers now, the ventricles of the heart. Okay, so naa siya'y bangag diha. So diri ang bangag niya. So mag-mix po ang unoxygenated blood and oxygenated blood. Okay? So yan, ventricular septal defect. This is the septum. There is a hole there. And then mag-mix po yung blood. Alright. So we have here the patent ductus arteriosus. This is seldom, rare lang po siya. Kasi usually this happens sa babies po. Yung sinasabi po natin na the first cry of the baby is very important because it will shut off all the shunts found doon sa circulatory system ng fetus. Okay. Kasi ang pressure that is brought about by the expansion of the lungs would shut off all the shunts. Ano yung mga shunts na yun? That is your ductus arteriosus, your foramen ovale, and your ductus venosus. But sadly, if the baby, no, hindi masyado umiyak, so ito po yung nangyayari. patent ductus arteriosus. It remains undetected man good sometimes kay konti lang po yung hole niya. Until such time that the mother gets pregnant, wherein there is an increase, no, in the pressure because ang heart nga nagdo-double time siya to sustain the needs of the baby. That is why dito nakikita na ngayon na meron palang hole si ductus arteriosus. So yan. So early surgical repair should be done. And of course, similar with ventricular septal defect in each other, there is a mixture of unoxygenated and oxygenated blood. Okay, let's go now to rheumatic heart disease. The causative agent would be your group A beta hemolytic streptococcus. This is considered as an inflammatory process and of course, autoimmune disease na siya. This also causes scarring of the valve. Okay? Yung mga nagtotonsillitis na tatlong beses sa isang taon, kindly remove na your tonsils because the causative agent of that one would be your streptococcus. The tissues that is found in your tonsils is equally the same as with your heart. That is why if your tonsillitis is left untreated, kaya nagargal-gargal na ka diha o warm saline solution, those bacteria might thrive sa heart. So this can cause damage sa imong heart. Okay? Yun. So what are the signs and symptoms of cardiac diseases? Not all manifest. If you have cardiac ailment, either doon sa na-mention ko, hindi po lahat ito mafe-feel ng patient natin. Okay? So, first will be shortness of breath. Then, sometimes, orthopnea, yung feeling mo na of breathlessness, para kang nalulunod. The only time that you would relieve from orthopnea is to orthopnic position, which is your recumbent position, or sitting or standing. In this manner, you would be relieved from orthopnea. Then sometimes expectoration of blood. Okay? Then cyanosis. When you auscultate the heart, you can hear murmur. Then of course, heart enlargement. Okay? So either of the symptoms, I'm not telling na lahat ng may cardiac ailment, ito lahat ang ma-feel niya. Alright? Some of the patients would feel palpitation, some parang nalulunod, depending sa case ng patient. Right? So what would be the functional classifications of cardiac diseases? Okay. Class 1 would be asymptomatic. Yung left to right natin na, ang tawag ba dyan, na cardiac ailment can be classified as class 1. Alright? Class 2 naman, symptomatic siya but with normal activities. Alright? Class 3, symptomatic with less than normal activities. Class 4 naman, symptomatic siya and at rest. Class 3 and Class 4, it's a no-no for you to get pregnant. Alright? Yan yun. Kaya gina-classify nila. No? Ang Class 3 and Class 4, we have what we call pa mortality and morbidity pa yan. It's either you're going to choose if the baby would be alive or the mother. No, mga ganyan. Kasi nga, very weak na po si mama, class 3 and class 4. So, exertion through labor is not allowed. So, cesarean delivery talaga sila. But knowingly, if you're going to have cesarean delivery, you will be sedated. So, ang heart mo maghihina. CNS function would be depressed. So much more in danger po si mama of cardiac arrest. At the same time, no, pwede pong mamatay si mother or si baby. Kaya it's a no-no. Okay? So judgment of safety of pregnancy. Conception should be prevented. No? If there would be severe heart disease. Na-diagnose siya ng severe heart disease. Nga no pa man jud nga mag-buntis. Functional classification, class 3 and 4. So this would compromise not only the mother but also the baby inside the womb. History, may history siya ng heart failure. There is pulmonary hypertension. There is right to left shunting. Diba? Okay, severe arrhythmia, kumakalabog talaga always ang kanyang heart. Rheumatic fever, combined valve disease. You have your ventricular and atrial septal defect, forget about pregnancy. Okay, then acute myocarditis. This is inflammation of the muscle of the heart. Okay, yan. Those are things or those are the situation wherein the mother is prohibited from getting pregnant. No? Okay, what will be the management of cardiac diseases? Depending on the case of the client. So, of course, there would be termination of pregnancy by cesarean section. Depende sa functional class ng mother. So, there is a corresponding age of gestation wherein the doctor would say, let's perform cesarean delivery. Patients with cardiac ailment will not undergo labor process. Yung pasakitan pa mo siya through labor, di ba masakit na masakit yan. So, this can contribute to or can add up to the, kumbaga ba, adding insult to injury na ba tayo kung ipapalabor pa natin si mother na meron namang cardiac ailment. Of course, your doctor would suggest weight reduction. It might be that you have a lot of fat tissue surrounding your heart, okay? So it would be very hard for the doctor, no? Then rest, okay? Prevent infection. Kasi comorbidity na ang tawag dito, no? Meron ka ng medical condition, meron ka pang ibang, what you call this one? Ibang ailment or infection that needs to be treated. So, ang dami na pong inumin na medication. No? Treatment for infection, treatment for managing your cardiac ailment, mga ganun. Nandigoxin is usually used for clients. Please check on the cardiac rate of the client. If masyadong mabilis po, then that's the time we're going to give digoxin. But if it is not very fast, no, normal lang siya. So we need to consult the doctor if we would give digoxin or not. Then of course, diuretics. Okay, if there would be congestion, of course, the doctor would order diuretics. Okay, usually they use, depending on the cause of the ailment, no? Usually, furosemide is given, no? So, ano gani yan? Okay. Sige na lang. Kasi meron din tayong tinatawag na digoxin toxicity, no? Meron po yan. So, meron po yang antidote yan. I forgot the antidote. 5 or something yun. No, if you can remember, you can answer. Also, no, you're done with your pharma. Basta hindi ko siya malitok-litok na ano, na, na anong tawag dyan? Na antidote, no? Okay. Seldom lang man din to siya nagkakaroon ng toxicity. Alright? So, we go now to your nursing care of cardiac diseases. Of course, number 1 is vital signs. Through vital signs, we will know if it is increased or not, or do we need to give medications or not. Of course, provide rest and emotional support. Okay? The only emotional support that we can give to our client is listen. Okay? Because through listening and expression of feelings by the client, no, the burden they are carrying with them would be lessened. Okay? Intake and output monitoring is very important also. In this manner, we would know if the patient is retaining fluid or not. Kasi kung mag-retain siya ng fluid, it can add up, no, sa kanyang problem. Pwede siya mag-congest. And congestion causes cardiac, ano pa yung tawag na, pagod na si heart. So, we can have cardiac arrest for this one, no? Kung overload na ang patient natin. Proper nutrition, of course, low fat, low salt diet is the main nutrition of our client. And in moderation lang po yung food. Okay. Carry out natin ang medical orders din. Syempre, titingnan natin din. And we do our responsibility of monitoring our client, whether to give the medication or not, or to refer to the doctor if we are in doubt, no, of the vital signs we have taken. All right? Yeah. Of course, we will proceed to gestational diabetes mellitus. Okay, this is the second medical condition our client, particularly pregnant mother, can experience. All right? So, it occurs in pregnancy and is caused by pregnancy hormones. Insulin is not working effectively because of the pregnancy hormones increase in the sugar level sa body ng mother is left undetected by insulin. Insulin produced by our pancreas, right? Usually goes away when the baby is born. Kaya nga tinawag siya ng gestational, it only happens during pregnancy. Okay? It increases the risk of type 2 diabetes for the mother later in life. So if the mother has history talaga of diabetes, it runs in the family. So most probably, meron siyang at risk po siya in developing type 2 diabetes. Mothers are advised to see the doctor yearly for diabetes test. Okay? Pag andito sa picture natin, pag high blood glucose level si mother, it would bring extra glucose to the baby. So, pag dinala yun sa baby, wala namang paggamitan si baby ng glucose, the tendency of the baby would be to what? Store the glucose. That is why the cause of the baby to put on a lot of weight. So, it is presumed always that the baby born out of a diabetic mother is macrosomic talaga. Alright? Sige. Risk factors causing BDM. So, of course, you have obesity. Then you have a family history. It runs in the family. Personal history. Okay, you yourself also has episodes of increased blood sugar level. No? By your lifestyle. Okay, what are you? You are fan of really drinking sodas, juices, and everything. You forgot to drink water. Yun ang water mo. No? Then sedentary lifestyle, wala. Kay ginabuhat. No activities. No exercise. No? Then of course, improper diet. Kain dito, kain doon, of course. No? Wala kang control. Everything is over. That is why sometimes good all of the mostly diabetic persons are really obese. Okay? Yan. So let's go now to the pathophysiology of your gestational diabetes. So we have here the hormone human placenta lactogen. Okay? So this would decrease insulin sensitivity in pregnant mom. Okay, this particular hormone. Okay, if there would be decrease in insulin sensitivity, definitely the mother would experience hyperglycemia or increase in the blood sugar level. Okay, and after that, together with the hormone of pregnancy, estrogen and progesterone, there would be an increase in the insulin production. Why? Because insulin is not used to dissolve the sugar level in the body. And in this manner, this would cross the placental barrier. Okay? The increase in the blood glucose, excess glucose would cross the placental barrier. Then after such, the fetus would experience fetal hyperglycemia. Okay? So, increase ang insulin production ng baby. So, there would be increased then fetal hyperinsulinemia. So, fetal hyperglycemia would increase, no? All of which, increase insulin, fetal hyperinsulinemia would increase ATP in the cells. Energy, di ba? Adenosine triphosphate in the cells are energy cells. All right? So, this would contribute to growth hormone. Alright? Yung fetal hyperinsulinemia natin, guys, would uh, increase the size of the baby, no? Ang growth hormone. So, this can lead to macrosomia. Okay? Yan. Okay. So, ang nangyayari ngayon sa mother with diabetes would be na magkakaroon siya ngayon ng baby na malaki. Kung hindi niya i-control yung kanyang lifestyle na always eating and the mother is not taking in or is not injected with insulin to decrease the sugar level, it can cross the placental barrier and the effect would be on the fetus. Okay? So sooner or later, when the mother gives birth, wait lang guys. Okay. When the mother gives birth, so she will have difficulty. Okay? So sometimes din guys, no, there would be complications na nangyayari dun sa baby. Sa kalaki ni baby paglabas, hindi porket malaki, there is a very big chance that the baby would survive. Remember, inside the womb, the baby is experiencing fetal hyperglycemia and fetal hyperinsulinemia. That is why this insulin in the fetus, kasi hindi man ma-detect talaga ng insulin ang presence of sugar, iihi na lang yan ni baby. That is why maglaki or mag-increase yung amniotic fluid ng mother. Kaya nga, together with your GDM would be your polyhydramnios na complication. No? Ihi ng ihi si baby, nag-increase po yung amniotic fluid kasi iniihi ni baby ang insulin. Insulin in fetus would serve as diuretic. That is why ihi ng ihi si baby. Then macrosomia, sobrang niyang laki. Okay? It can also cause prematurity. No? Kasi nga, di ba, increase in the blood sugar ng mother would really cause the blood to be very viscous. Alright? Kung viscous ang blood, slow ang takbo ng dugo towards the placenta. At the same time, mahina din ang supply sa baby. So, minsan, kung uncontrolled talaga ang sugar level ni mama, no, during early pregnancy, hindi talaga siya na-treat properly, so this could happen. Mapaanak siya na maaga. Okay? And of course, it can cause respiratory distress and neonatal hypoglycemia. Ito ang pinaka-worst na mangyari sa baby in the extrauterine life. The baby is provided for a lot of sugar. When the baby would be born, no, wala nang supply po ng sugar. So makaka-experience si baby ng hypoglycemia. If this will not be assessed properly, the baby might die. No matter how big the baby is. But if low ang kanyang sugar, first niyan magiging comatose si baby. Then the baby would die. No? Ganun yan. So if the baby would experience any signs, nagblue-blue na si baby, nahihirapan ng huminga, there would be effort already sa chest niya, nahihirapan na siyang huminga. Ibig sabihin, nakaka-experience na siya ng hypoglycemia. So, the pediatrician would really give glucose sa baby. Kasi nasanay na siya sa loob ng tiyan. But it will gradually decrease ang supply. Isanay lang ang katawan ni baby na there is glucose but with limitation lang. Okay? So, yan. Alright. So, factors that predispose to large for gestational age. O, ito na. Excess na lang po din ito, no? Na mga, tawag mo dyan, mga factors, no? Kasi nami-mistake po yung large for gestational age. Akala nila kung malaki si baby, diabetic na yung mama. Or LGA is often times called as macrosomia, which is not. Okay, so we have here the maternal factors and fetal factors. Ang maternal factors naman, isa ito sa mga factors ng LGA. Siyempre, diabetic yung mama. So most probably, dako iyang baby. Then, dako pud si mama. Dako iyang belt ni mama alang manggamatoy si baby, no? And of course, post-datism o lumampas na po ang gestational age niya ng 42 weeks. So ibig sabihin, very old na si baby inside. So malaki na talaga siya. So pangit gyud ang mga baby na post-datism. Nangungunot na yung mukha nila, mahaba na yung kanilang mga kuko, wala na silang lanugo, wala na silang vernix caseosa sa katawan. So there is no more moisture. Ang tawag mo dyan, oy? Parang, ang vernix caseosa kasi, guys, nagsiserve yan siya ng as moisturizer sa baby. Okay, multi-party advanced age. This is because as we age, our cells also age. Right? Yan. Previous large gestational age baby. So, kung malaki talaga yung mga baby na pinapanganak ng mother, ganun na talaga yun. Okay? And of course, it can also affect na malaki talaga yung stature ni mother. Okay? Fetal factors naman, genetic or congenital disorders that make the baby very big or bloat. Yeah. Usually, ang affected dito, male gender. Kasi in the real, good, male babies are supposedly very big. Big sila compared to female babies. Okay, congenital heart disease, especially TGA, no? Or your transposition of great vessels, wherein the position of the pulmonary artery and the aorta are switched. Okay? Nagbaliktad sila. It was said here, large for gestational age is an indication of high prenatal growth rate, often defined as a weight, o open close parenthesis, or length or head circumference that lies above the 90th percentile for that gestational age. Okay. Macrosomia, also known as big baby syndrome, is sometimes used synonymously with LGA or is otherwise defined as a fetus or infant that weighs above 4,000 grams, around 8 pounds and 13 ounces, or 4,500 grams, 9-pounders baby, and 15 ounces. Regardless siya ng gestational age. So minsan, ang mga LGA babies talaga is not born out of a diabetic mom. It's just so happen na dagpo jud ang kanilang genes. No? Ana. Okay, your TGA also, guys, or your transposition of great arteries, no, is also called a cyanotic congenital heart defect ng baby. Okay? Yung nakalagay dyan, open ko, happy, chubby, blue infant. The baby is blue, guys. So, ibig sabihin yan, is a problem. Okay? So, yan. So, balik tayo sa maternal complications of GDM. The mother might experience preeclampsia. Alam niyo naman, guys, kakambal talaga ni diabetes is hypertension. So, if the diabetes is left untreated, lumalapot yung dugo, it would increase the blood pressure, ang takbo ng dugo sa katawan. So, this can result to preeclampsia sa mother. Then, polyhydramnios, the one that I explained earlier, ang hyperinsulinemia ni baby will serve as a diuretic, kaya ihi ng ihi si baby po. Then, of course, infection. Alright? Supposedly, very acidic yung ating vulva for us to be protected against infection. It so happen if you have diabetes, matamis po ang vulva. Alright? So, opportunistic infection can readily get in. Okay, dystocia. The mother might experience difficult labor. Okay? Yan ang dystocia. And of course, postpartum bleeding. Gipugos jud og anak si baby na 9-pounder. So the mother might experience some laceration despite na nag-episiotomy tayo during delivery, but the baby is way too big. Kaya nag-lacerate. So it can be, ang laceration can happen sa cervix, sa anterior or posterior part ng vaginal wall, or even yung ginawa natin na episiotomy can lacerate further until the anus. So it can readily happen. So postpartum bleeding po tayo. or sometimes na overstretch na po yung uterus ni mother, so hindi na po siya gumanang kumontract. So the mother experiences uterine atony, which can lead to postpartum bleeding po. So yung birth canal trauma is, na-mention ko na early. Then of course, the mother can have cesarean delivery because the baby cannot fit the pelvic inlet because it is very big. Okay, so the doctor will opt for a cesarean form of delivery. Right? Sige, let's go na to the fasting and 2 hours postprandial venous plasma sugar during pregnancy. So, in 3 columns po siya. So, ang fasting, so less than 100 milligrams per deciliter, kung fasting, no, magche-check tayo ng glucose level. And then, ang 2 hours postprandial, below 145 milligrams per deciliter. So, ang result talaga niya is not diabetic. Kasi all less than. Alright. Bag ang fasting mo, more than 125 milligrams per deciliter. And of course, ang 2 hours postprandial mo is more than also 200 milligrams per deciliter. So, the doctor would really diagnose you as being diabetic. So, kung 100 to 125 milligrams per deciliter, pag fasting, then ang result naman ng 2 hours is 125 to 200 milligrams. So, borderline po tayo niyan. So, the doctor might order for a glucose tolerance test. Alright? Pag ganito yung result mo ng fasting and 2 hours postprandial. Alright. So, let's go now to your oral glucose challenge test or your OGCT. So, fasting, post-midnight tayo. Then, in the morning, blood and urine specimen are obtained. Then, after such, you will be advised to take 50 grams glucose. Inumin mo yan siya, 50 grams. After an hour, a blood and urine specimen is obtained. So, a value above 130 to 140 grams per liter as a threshold for performing a 3-hour OGTT. Kung ang value ng result ng OGCT mo is above 130 to 140, so, ibig sabihin, ito po yan siya, ang result niya is pwede magsabi si doktor, okay, this is way too high, so we would go to a 3-hour OGTT. So, yun ang mangyayari sa'yo. So, what would be the prerequisites of OGTT? So, ikaw, kung for OGTT ka, scheduled ka for OGTT, normal diet ka for 3 days before the test. Then, there would be no diuretics 10 days before, and at least 10 hours ka nag-fast. Then, test is done in the morning at rest. Okay? So, criteria for OGTT, the maximum blood glucose values during pregnancy. So, at fasting, 90 milligrams per deciliter ang result. Okay. Then, 1 hour after, it should be 165 milligrams per deciliter. Then 2 hours, 145 milligrams per deciliter. And 3 hours, 125 milligrams per deciliter. Ang purpose nito, every hour, kasi wala kang intake ng food nito. Kung 3 hours ka, until the 3rd hour, dapat, kung kukunan ka ng dugo, sa 3rd hour mo, dapat mababa na siya compared to the second, past 2 hours. Alright? Sige, yan. So, ano natin yan guys ha? Anong tawag yan, oy? Nakalimutan ko na tuloy ang aking sasabihin, oy. Ito yung sinasabi ko kanina guys ha. Mag-FBS ka, mag-fasting ka pagkagabi. In the morning, mga 6 o'clock, kukunan ka ng dugo. Then kung naiihi ka, as well as kukunin ang ihi mo. Just to check for the presence of sugar in your urine. And of course, your sugar level fasting. Alright? Then, you are made to drink 75 grams. Ito yung OGTT, guys. 75 grams. Then, after an hour, 75 grams of glucose, yan ha. And after an hour, a blood is extracted again. No? So, ito yung mga result niya dapat, guys. Okay? Then, after an hour from the second extraction, dapat, ito na naman yung result mo, 145. Then, until such time, sa third hour, na 125 milligrams per deciliter. Kung above this one, then you are really diabetic. Okay? So, the management of BDM, madali lang po yan. Diet, exercise, and insulin. Okay, kung ma-manage mo pa ng diet alone, very fine talaga yan. Alright? Then, combine it with exercise, much more. Okay? Then, ang ano lang natin guys is, once you are with insulin medication, then you need to eat. Alright? Or else, you will experience hypoglycemic episodes. And you would not really like it. Okay? Iba yung pakiramdam ng na-hypoglyce. Right? So, let's go now to substance abuse during pregnancy. Okay. Substance abuse kasi yan, ano guys, ang next talaga. Alright. So, we go now to, okay, substance abuse is considered ang mga substances teratogen. So, what is teratogen? So, these are any agents that interferes with normal embryonic development. It can alter the embryonic process. No, lalo na pag you are using a teratogen on your first trimester of pregnancy. Right? So, let's go now to alcohol. Okay. Alcohol can cause CNS depressant. If you constantly drink alcohol, all the systems in your body is para kumbaga slow. Okay? It reduces anxiety daw. For temporarily lang. Okay? Yes, it can cause sedation. Kay in cloud 9 ka man if you are already under the influence of alcohol. And of course, mind you guys, dalawang system po ang nade-depress po when you take in alcohol. Your CNS and your respiratory system. So, depressed po sila lahat. So, if you are pregnant with two systems depressed, so what will happen to your baby? That is why alcohol is considered as a teratogen. Right? Sige. What will be the alcohol effects on the fetus? I know you know this already. You have this fetal alcohol syndrome or your FAS. So, these are the facial characteristics of the baby with FAS. No? Epicanthal folds, small eye opening, parang si Garfield, guys. Flat mid-face, upturned nose, smooth philtrum, thin upper lip. Okay, guwapo pa gani ang baby di Ari. But there are other pictures talaga that you can really see the abnormality caused by alcohol. Lalo na pag ginawa ng tubig ni mama yung alcohol because she is depressed. No? Kaya yan yung nangyayari. It can also cause intrauterine growth restriction. Syempre, depressed po ang mga system natin. Nagsuslow yung mga takbo, no? Ng mga equal to that one would be ang circulation mo, ang blood circulation mo contains alcohol. This can hinder the growth of the baby inside the womb. So, kung mahina po yung takbo, mahina po yung supply sa uterus natin. This can indicate what? Kung mahina talaga or deficient ang mga supply sa uterus natin, this can trigger the uterus to contract. So, the mother might experience preterm delivery. Okay? Kawawa naman si baby. And now, let's go now to opioids or your morphine, heroin, methadone, and analgesics. So this all can cause, no, and considered as teratogen sa baby. Drugs po ito, no? No drugs is allowed during pregnancy. So any form of drug, even how mild your analgesic will be, it's still a drug. It needs some doctor's clearance. Alright? Yeah. So, meron din tayong stimulants such as your cocaine, amphetamine, ecstasy, usually ginagamit ng disco-disco, no? And of course, caffeine, found in coffee. So, ang mother natin di pwede mag-inom parati ng kape. Kung mag-inom man siya ng kape in moderation, tama lang sa laway. If the mother is used to drinking coffee when she is not pregnant, no? So, i-refrain natin. We can only advise the mother to do that. But siya lang talaga yung uh, tigil ng pag-inom ng kape. And we cannot change anybody, guys. We can only teach them, advise them, no, of the ill effects of this particular teratogens, not only sa body ng mother, but also sa growing baby inside. Right? Yeah. So effects of stimulants, of course, increase concentration, alertness, paranoia, hypertension, and psychosis. So vasoconstricted po ang mga blood vessels natin. Kaya you are hyper, no? During taking of these stimulants. Wide awake ka. Okay. But remember always that these are, no? Form of a teratogen that can also destroy brain cells if this is used in abundance. Alright? So, iwas-iwasan lang po natin yan. So, stimulants effects on fetus. Of course, preterm labor. Okay. Spontaneous abortion, placental abruption, and fetal hypertension. Remember, when we stimulate the person, no? Stimulate the person. When there is alertness, no? Or when there is hypertension, that would really mean that the blood vessels all throughout the body of a particular person is vasoconstricted. So, ang pagkakaalam natin sa vasoconstriction during pregnancy would be, kung vasoconstricted po ang blood vessels ni mother, of course, definitely it can affect uteroplacental sufficiency. All right? So, maliit lang po ang mapupunta sa baby and sa placenta. So, kung limit lang po ang supply doon, it can stimulate contraction. All right? Kasi the placenta would detect it as, okay, so limited na yung supply ko, I am old already siguro, then I would detach. Oh, yun. Kaya ang nangyayari sometimes is placental abruption. Early detachment of the placenta from the maternal wall. This can put the baby into a very risky situation because that is the only source of the baby for blood and oxygen. Okay? So if the placenta is detached early, then the baby will be monitored further. Then a sign of respiratory distress would be an increased more than the normal range sa kanyang heart rate, then biglang bumaba yan siya until such time that the baby is compromised already. No? Yan yung nangyayari. Kaya bawal po ang mga teratogens. Likewise sa ating nicotine, which is found in cigarette. Kaya smoking is prohibited during pregnancy talaga. No? Kasi it contains nicotine that causes our blood vessels to constrict. So always lang talaga natin tandaan, no? Kung merong vasoconstriction, compromise ang pregnancy po. Alright? So, pregnancy, smoking during pregnancy, no? Higher rates of spontaneous abortion, placenta previa can happen. So, mahina po yung kapit ng placenta or low-lying po yung placenta natin. Then, preterm labor, low birth weight sa infant, and fetal hypertension. Low birth weight, syempre, kung limited ang supply, paano ka mag-grow? Okay? Then, let's go now to Mary Jane or your marijuana joint with whatever you call it, it's still a plant that is supposedly a medicinal one, but when it is used abusively, it can cause ill effects on a person. Okay? Particularly if you see a person nakasiga ang mata niya, bloodshot eyes, mapula yung mata niya. So nag-weed yan siya. Alright? Or joint, no? Whatever you call it in your generation, no? Sa amin noon, si Mary Jane, si weed, si joint, no? So marijuana yan siya. No? Relaxant. In some other states, doon sa labas, no? This is normal, no? Normal. Or legal pala, normal. Legal ang paggamit nito because this is it can help, no? A person daw. Okay. Oh, sabi nga dito, sa din daw yan, tawag is hash. All right. Taken. Okay. Okay. So, what is the effect of marijuana? It will serve as a relaxant. And sometimes, if you overdo it, you can experience hallucination and short-term memory loss. And of course, it can also cause low birth weight on an infant. Sometimes kasi, ang iba, gumagamit sila ng marijuana is for them to eat a lot, no? Nag-increase ang appetite niya. Short-term memory loss, nasa cloud 9 ka, kaya sobraan kang marijuana, no? Ayan. So, bawal din po ito. It is one form of a teratogen that is when you abuse this one. Lahat naman talaga ng sobra, guys, is has an ill effect, right? Okay, lifetime effects of substance abuse. So this can cause physical deformities, lalo na if you are very abusive, you are taking a lot or you have a lot of vices during pregnancy. Tapos natunong pag yun sa development stage ng baby, which is the first trimester. So minsan nakukulangan ng fingers, kamay, walang ilong, walang tenga, yung mga babies, no? So there are physical deformities. And mental retardation also. Just like when you are taking amphetamine. So, ang brain cells na ng adult namamatay. Paano na lang yung mga baby inside the womb? Then, of course, developmental problem. So, these are the 3 lifetime effects of substance abuse towards the baby. Okay? Yeah. So, question so far? So we have still 45 minutes. So I hope to discuss a little with, teka lang, at least man lang, makuha natin yung isang topic. All right. Okay.